I'm so grateful because I know it's Saturday morning and you have 7 kids at home.
Yeah,
So
well,
it's kind of a miracle.
right now 8 of them are here. Oh, well, my 22-year-old son may have spent the night somewhere else last night.
That's awesome.
Usually all the heads are not accounted for till 9 or 10 in the morning.
Exactly. Well, I so appreciate it. Like, I can't even tell you how much I appreciate it. And I really wanted to do this interview for a couple reasons, but one of the reasons is just that so much of the information I've gotten about pandas and pans has been through other pandas and pans families. And I feel like amid their own suffering, they're just always amazing at using their own experiences to help others, even if they're still in the middle of all the turmoil. And so part of this is really just for me to feel like I'm paying that forward. Like, I've learned so much from you. And I feel like there's so many questions I've had over this past year that you've treated my child that I now understand. And I just want other people to have some of that same clarity over these things.
Right. No, my experience with people, so I've been doing what we now call LDI for going on 11 years.
Yeah.
But nobody heard about it until 2014, 2015, when I developed a way to treat Lyme disease with this technique, right? And then suddenly everybody heard about it because the Lyme community, like yours, like the PANDAS community, has a strong presence and sort of community on the internet, and they share information with each other and it spreads rapidly. When I was just teaching doctors, things go very slowly because doctors are very narrow-minded, they're very dogmatic, they're very hard to explain things to that are not already part of their mentality. Not to bash doctors because they're just like every other human being, honestly, in that regard, but they're not very quick to change usually. But sick people who are desperate and looking for answers in a like rapid fire sort of way are a lot more readily, available to listen to you.
Amen.
And so I like the opportunity to talk directly to the consumer. I wrote this book years ago that's insanely huge, but I have a big section there about what's wrong with the medical community in general. It's basically, I explained that like the healthcare system is a consumer-driven industry. People don't appreciate that the consumer gets to decide how they spend their money and what services they seek out, and they don't appreciate the power that they have. It is limited in the fact that a lot of people can't afford to pay things their insurance doesn't pay for. So the medical industrial complex kind of controls what they are willing to pay for, and it's all drug therapy based, pretty much conventional stuff. And if you want to do something that's not conventional drug therapy, like you want to do Chinese herbal medicine, or you want to do hyperthermia, you've got to go to Germany for that. You want to do ozone, you want to do all kinds of different things. It's out of pocket, which is sad. And I honestly don't expect that to change in my lifetime, unfortunately. But anyway, I like the opportunity to talk directly to people because they're actually willing to listen.
Yes, for sure. And I mean, I'll kind of introduce you to people really quickly, just in terms of like what your expertise is. So obviously I know you had your family practice in Anchorage, Alaska, and you have all this experience with like things you were talking about, Chinese medicine and just immunotherapy and nutritional medicine and a wide variety of things. So can you just like briefly tell people like why you are now only doing low dose immunotherapy remotely with people around the world, and sort of just briefly about like how that relates to the PANDAS PANS community and like how you help these kids?
Sure. Well, before I got into medical school, I had this kind of alternative medicine bent. Like I was reading Andrew Weil's books, and I was reading, some other things, and thinking about medicine in what I didn't even realize was a kind of alternative way, like holistic way. And I was reading biochemistry, like nutrition textbooks and things to try to prepare myself for medical school, which ultimately was a total waste of my time in medical school because they didn't teach you any of that. So that was my mentality though. And to go back even further than that, I never wanted to be a doctor. Like I wanted to be a scientist. I actually wanted to be a marine biologist because I really liked the water and all that. But then for personal reasons that involved being a young person falling in love with, a woman, I like totally went to a different college than I intended. I was actually accepted to Hawaii to come here in the middle of my undergrad and study marine biology. And then I changed my plan completely, stayed in Anchorage, Alaska, finished college and got a biology degree and thought, well, I guess I'll just go to medical school. What the heck? That was like all the thought that I gave it. So I never really bonded with the doctor community mentality. Like I'm going to be a doctor. It was never my mentality. I always felt like I'm going to be a scientist. And in this scientist field, the goal is to help people, right? So the goal is to always do your job better. The goal is always to figure out ways to help the people who come to you for help. And that simple kind of mentality is what has led me to learn more and more different skills and tools over the years, because you keep hitting walls and dead ends with no matter what you're taught. Whether you're taught acupuncture, which I learned acupuncture my last year residency. I did like extra time as chief resident with 3 kids at home. I did this extra 300-hour training course in acupuncture for physicians on top of it, just so I could have another tool in my toolbox before I even got out of residency. And then I learned Reiki. I'm actually a certified Reiki master and teacher, but I suck at it. Don't do it. So, and then I learned all these things because I would run into people that I could not help.
Yeah.
And I mean, in practice as a family doctor, I delivered babies. I managed my own ICU patients. I actually got credentialed to do colonoscopies and upper endoscopies. So the patients I talked to who have had, gastrointestinal problems, and they talk about their endoscopies they had, I know exactly what it all looks like.
Right.
So I've been there myself. And there's not much in medicine I haven't done, which helps me a lot. And then when I got out in my own practice, which was actually in Wasilla, Alaska, which is where I'm from.
Yeah.
It's near Anchorage, but it's distinctly different. I just kind of geared my practice towards figuring out the problems that medicine had not figured out. Like that's where I lean. I even put letters in all the local doctors' mailboxes at the hospital, because I was working in the hospital before that, and said, hey, send me all your patients with fibromyalgia, with irritable bowel syndrome, with migraines, with chronic fatigue that you can't stand to see, right? Because they have nothing to offer these people. They think they're all mentally ill, but they're not. It's like, send them all to me, because that's who I want to take care of, and I want to figure out what's really wrong with them. And incidentally, I got 0 referrals from doctors in my community. 0.
Yeah.
But it built word of mouth. Word of mouth was within the state of Alaska, which for reference is half the size of the continental US.
Yeah.
Geography of Alaska, I had patients driving to see me from every corner of the state, flying in or driving to see me after a while, because I was the only one who seemed to care.
Yeah.
Solve their problems. So anyway, that's how I ended up where I am, is that I just keep looking for answers to the people who so far have not gotten answers, right?
And those mostly people with immune system. I mean, not always, but like
a lot of them. So I ended up here because that's where the path has led me. Prior to that, what I discovered was a very common key to success was hormonal therapy. So I actually became extremely good at doing hormonal assessment and bioidentical hormone replacement for people. I taught workshops to other doctors how to do bioidentical hormone therapy for years before I developed what is now called LDI. And so when I had my own clinic in Alaska, I mean, I did a lot of detoxification stuff and nutritional intervention, and I eventually hired acupuncturists in my clinic, so I didn't do that myself. And we had hyperbaric chambers, and I had all these tools, and I was doing a lot of hormonal manipulation. But then I would run into a large portion of these people, and I did LDA also. So like for allergies, I started doing LDA for allergy therapy in 2008, which is a long time ago now. And so I had a lot of these tools, but the thing that I was really good at was figuring out people's endocrine stuff, which is a very common upstream cause of all sorts of chronic illness. But I ran into lots and lots of people where none of that fixed their problem, right?
Yeah.
I managed a lot of autistic kids. So PANDAS and PANS is really kind of tangentially related to the autism spectrum.
And can you talk about why that is?
Yeah, it's brain inflammation.
Yeah.
So to talk about the diagnosis of PANS for a second, it's not a real diagnosis. I mean, PANS is a is a symptom complex, right? So, but it's not a diagnosis, because in my opinion, a real diagnosis should speak to causation.
Yeah.
You know, like I have type 1 diabetes, which means I don't make insulin. Yay for me. So I have to inject insulin to stay alive, which sucks. And I got that at age 39, not as a child.
Wow.
But the thing is, that's a clear-cut diagnosis. You run a few lab tests, you're like, oh yeah, you have type 1 diabetes. It's obvious. You're missing this one hormone, right?
Yeah.
But then it begs the question, well, why? You know, why does anybody have type 1 diabetes? What is the upstream cause of that? And doctors don't go that direction. They go, oh, here, you need insulin. You'll stay alive. And that's great, but I'd like to make my disease go away. So actually, for the last 4 years or more, I've been trying to find an LDI antigen that will work for type 1 diabetes and have not yet. So for all the patients out there who I've worked with for a year or two and have struggled to figure out what antigen you or your kid needs, I totally understand.
Yeah, you're
been
trying to figure it out.
Life-threatening illness, you know, I've nearly died 100 times from this disease, and I still haven't figured it out, but you have to keep trying. So PANDAS is like saying somebody has a fever. It's my analogy, right? Like if you walk in and you have a temperature of 102, you have a fever, but that's not a diagnosis, right? That it just means you have an inflammatory response going on in your body, that your immune system is activated against something. Then the doctor's job is to figure out what the thing is. So you have to say, okay, you have a fever, and what else? Like, do you have a sore throat? Because then it makes you wonder if you have strep or you have a viral syndrome. Do you have burning when you pee? Because then you have a bladder infection. Are you coughing up a bunch of green mucus? Because then maybe you have pneumonia, right? You need more than just the fever part. So PANDAS and autism spectrum stuff, and you know, if you end up seeing a neurologist, they'll say, oh, you have autoimmune encephalitis, you know, or you have like whatever. It's all just hand-waving nonsense. Honestly, it's not a real diagnosis. It's a description of what's going on. And that's an important distinction. So what I would tell your PANDAS population is, don't cling to that as a diagnosis. Don't go around saying, my kid has PANDAS. You say, my kid has neurological inflammation. I'm trying to figure out why. Yeah. Right? So if you have a child with eczema who's got just weeping, red, crusty skin in all these visible areas, you don't say that he has inflammatory skin syndrome. No. You know, like he has eczema. But it's still a symptom. Like you have to figure out why the kid has eczema. Is he allergic to yeast? Is he allergic to foods? Is he allergic to some of the fungi that lives on his skin? Does he have a chemical contact sensitivity to the detergent you're using? You got to figure it out, right? And people talk about leaky gut syndrome. Leaky gut syndrome is not a diagnosis. It's a symptom. It's you have inflammation of the gut, but that could be caused by a myriad of different things upstream. It's an immunological condition in almost every case. So PANDAS is an immunological condition, probably in just about every case, right? So, but it begs the question, what are you reacting to? And, you know, and so it doesn't point to that. And no matter what laboratory panel you've done a Cunningham panel, or you've done the Shoemaker mold toxicity panels, none of those things actually tell you what's going on. The experts in those fields want you to believe that they have answers for you. They do not. Yeah. They don't. It's flailing about, and they've all made up their own criteria. You know, like the Cunningham panel, like, oh, the kid looks like they have PANDAS based on the Cunningham panel. Okay, well, if I give that kid the LDI strep antigen, their symptoms should go away. And a lot of those kids, they don't. So then,
and can you explain, because a lot of people watching are not going to know what LDI is. So can you describe like what that is and how it relates to, right? Like if you know a kid has this sensitivity to strep because they get strep, you take the antibiotics, they get rid of the strep, but they are raging, they have OCD, their math goes downhill, their handwriting goes downhill, they are no longer themselves, they can't sleep, all of these things. That's pretty clear that they have a sensitivity to strep. And
that is the history that I look for. You know, like some of these people say, well, this doctor said we have PANDAS. And I say, okay, well, why? You know, what's the evidence? And if they only point to like an elevated ASO or an elevated DNASP or a Cunningham panel that's suggestive of it, but they don't have the history you just explained,
Yeah.
then I don't accept that as factual, you know. So, but if you have a child who every time they're like a kid who had strep 4 times a year for 3 years in a row, and then finally one of these episodes led to the development of all those neuropsych symptoms you just outlined.
Yeah.
And maybe a scarlatina rash or not, you know, whatever. Like, okay, the timing makes sense. The history makes sense, because it's very, very unlikely that you're going to see a kid who has PANDAS, which means they react to strep. So the PANDAS diagnosis is a real diagnosis if it's accurate, right? Because it tells you that they react to strep. So in a very literal sense, any kid that I get who truly has PANDAS should respond to the strep LDI. It's very
Otherwise they have PANS or something else.
Otherwise they react to something else, right?
Yeah.
It just has similar symptom profile, and there are lots of other causes that can do that. People need to understand. So when I get those people,
like
tell
what?
Me, my kid's never had strep throat once in his life, but he has PANDAS. I'm like, probably not.
It's just like it's become sort of this umbrella term, because again, with PANS, they just know that when their kid gets sick or is even around somebody who gets sick, or they don't know, you know, there could be so many things. So can you talk about, like, what antigens you typically, like, when a kid has all these neurological, mental illness, things we think of as like mental illness, and they seemingly either come out of nowhere, or maybe they don't, but they've always had some of these mental illness issues, and it seems to correspond with their health, you know. Can you describe like what LDI does for them and why?
Yeah. So the term immunotherapy in general means that you're trying to manipulate the body's immune response to something. And it's a very, nowadays, it's a general term that could mean either direction of influence. So like if you do an immunotherapy for cancer, you're actually making kind of a cancer vaccine, and you're trying to stimulate a strong immune response against the cancer cells.
Right.
Or if you give somebody a vaccine, you know, a vaccination for measles, or a vaccine for influenza, or, you know, if they ever develop a vaccine for coronavirus, which I don't think they ever will, to tell you the truth. And I'm not going to get it if they do, but that's beside the point. A vaccine, the intention is to stimulate a strong immune response against the target antigen, whatever it is, right? But this kind of immunotherapy goes the other way. So immunotherapy, like for allergies, if you go have immunotherapy shots for hay fever or what have you, then the idea is to use a diluted version of that thing and get the body's immune system to stop reacting. So rather than instigating a reaction, you're trying to stop a reaction. And the difference is dilution. So if you give somebody a strong amount of something, you can induce an immune response against it, a la typical vaccination. What's weird, and what we don't really understand, we don't understand why this is the reality, but it is the reality, is if you dilute that thing out with water just over and over and over, you will find a dilution which correlates to a signal. It's basically an energetic signal you're giving the body, just like homeopathy. The concepts of homeopathy apply here too. You find a dilution of that thing that stops the immune reaction against it. Instead of stimulating it, you can stop it. And the difference, the solution is the dilution, okay? And so what we do with low-dose immunotherapy is we find what dilution of that thing neutralizes the immune response for that particular individual. And it is an individual thing. It is diverse. And because of that, there's not a one-size-fits-all dosing. Like, I can't say every kid with PANDAS responds to a 6C strep dilution. If it were that simple, wow, this would be way easier to use. All these other doctors that I've given LDI, training manual and antigens to would be doing a great job with everybody that walks in the door. But it's not that simple. It's individual.
It's an art and a science altogether.
Yeah, it is. And it's a collaboration between me and you. You know, it's a very strong relationship, collaboration, communication for quite a while in some cases to assess whether every individual dose really had an effect or not. And part of the challenge that's inherent there is that every immunological condition has a tendency to fluctuate. and
Yeah.
waver in severity. And in some people's cases, the symptoms can just go away for periods of time and then come back, and it's unpredictable. So when you give somebody an LDI dose and you see something change afterwards within several days after it, it could be coincidence, right? Or it could be that they just got exposed to strep and went bonkers because of that, and the dose that they just took wasn't the reason that they got worse. That's part of where this becomes difficult and challenging to figure out, and where like my experience comes in, trying to evaluate what may or may not have happened and how we're going to figure it out, right? So,
to try to take the emotions out of it, because it's very complicated to try to figure out as a parent, to then relay that to you. And talk to me about when you typically hear a parent talk about, because like we talked about, strep is a little bit more clear in terms of knowing what's going on. But talk to me about, do you find that there's a lot of parents who think their kid has issues with, let's say, mold, or issues with like Lyme disease, co-infections, vaccines, and what antigens do you, like when they have these neurological brain inflammation issues going on, what antigens do you find work well with these kids? And I know it depends on what they're allergic to, but.
Right, and that's what we have to figure out. So that what I do is I spend a significant amount of time talking to people, asking questions about what happened and when, and what circumstances seem to change it. For the people who are new to this whole idea, what I would say is, all of the laboratory data you've had done for you or your kid, ignore it. Don't even tell me about it, because it's not helpful. And all it will do is cause you to cling to a belief that may not be true, which is the biggest barrier to success I've encountered, honestly, is that people believe something to be true and it's not. So in the essence of science, we have to prove or disprove things along the way. What matters is the experience and the timing of things with change of symptoms.
Yeah.
It's like if a kid gets strep throat and their symptoms increase, that actually does not mean that their symptoms are caused by strep. Because anything that causes a robust immune response can accentuate immunological symptoms. So a kid who has dust allergy, if they get strep throat, their dust mite allergy symptoms might go ballistic. And it's got nothing to do with the fact that it was strep that they encountered. And so like, that's an important thing. Like, people will say, well, every time they get strep, they go nuts. And then I go, okay, well, what if they get some viral respiratory thing, a typical cold, and they go, oh yeah, their symptoms go ballistic from that too, just the same. Well, then that doesn't mean they're sensitive to strep, right?
Yes.
So that's a key question to ask. People all suffer from what's called confirmation bias, okay? So like, my kid gets worse when he gets strep, that means he reacts to strep. That's confirmation bias. The question is, because you want to believe that, it satisfies the belief you already have to believe that, right? So if I say, here's a differentiating question, well, what if they, get sick with some other thing? Oh yeah, that makes their symptoms worse too. Well, now your strep association is invalid. It might be true, but it might not be true. So
then what in general, how do you figure out, okay, well, I guess I have like a chicken and egg question. Like, let's just say, a kid who seems healthy, for all intents and purposes, seems healthy, gets strep, and then has all these neurological symptoms. Would you say, is that like is strep so insidious that it can cause immune dysfunction, or is it more like that's like a canary in the coal mine, where it's more of a proof that there was already widespread immune dysfunction and that was just another trigger?
Right. Well, there may not have been immune dysfunction prior to that event.
That's what I was wondering.
So what I've learned to think about is that there's such a thing as a catalytic event. So I use the term a catalyst or a catalytic event for the inception of an immunological condition. And it can be anything that causes your immune system to become elevated, overly activated. It could be a car accident. It could be a divorce. It could be losing your job. It could be a death of a loved one. It could be a vaccine. It could be catching strep throat. It could be getting a course of antibiotics to treat pneumonia. And then you have a die-off reaction to some normal organism in the body and it becomes an immune target. So all of these things, it could be for women out there, it could be having a baby. That is a very common one. Like you have a baby and 3 to 6 months later, you develop ulcerative colitis or food allergies or MS, whatever, like your immune system has this major shift. So a kid gets strep throat and then they develop immunological symptoms does not mean that the ongoing antigen is strep.
Got it.
It does not, because having strep is a very strong immunological stimulus. Strep causes at least 4 different described autoimmune or immunological syndromes that we know of. The classic is rheumatic fever.
Yeah.
Rheumatic fever gives you arthritis and a rash and heart valve deformity and neurological symptoms. I mean, it affects almost every organ system in the body, right? But it's not the bacteria doing that. It's the way the immune system reacts to the bacteria. You can get guttate psoriasis as a result of strep sensitivity. And even if you get rid of the strep bacteria from the person, their autoimmune disease sticks around. And then PANDAS is another one that's well described and understood. And then another one is post-streptococcal glomerulonephritis, this kidney inflammation you get after strep. All of these things are just totally chaotically unrelated, except for the fact that they involve strong immunological stimulation. Now, because of that, getting strep could cause you to develop an immunological syndrome that has nothing to do with strep. So like I was saying, the PANDAS story that's more convincing is my kid caught strep over and over and over and over again. And like the 12th time he caught strep, then he developed these symptoms. That's more convincing that strep might be the antigen from that point on. If it's a one-off, my kid was totally fine. He caught strep throat one time and then all this stuff started. It's actually less likely that strep is the antigen, but it's not zero. So like I deal in possibilities and probabilities and uncertainty. And that's one thing I would tell everybody watching this is try really hard not to be sure of anything until we've scientifically validated the theory. Yeah. Because that is such a huge barrier to my success with people and to their success getting better. Is they believe that this is the thing they react to. And so when they take a dose of it or their kid takes a dose of it, they believe that anything that happens afterward is a direct result of the dose. And that's a dangerous thing. It interferes with success in a huge way because the essence of science is that you have to repeat the experiment and get consistent results, right? So you either have to go with stronger doses and see kind of a building effect that leads you to see a correlation, or you repeat the same dose and get a similar effect, or whatever. You have to prove it, but people will get a single dose and a single effect and then have a very strong emotional reaction and belief about it.
Whether positive or negative.
Whether positive or negative, like and of course people who watch my videos and whatnot around the internet are aware that I give people placebo doses, right? Because that's the only way for me to find out. Like, well, is this really what's happened? Is it a cause and effect from the dose to the response? Is this person just really overanalyzing what's going on? Because a lot of the parents of kids who have PANS and PANDAS, that personality type, it's not the inherent personality, it's the personality that the disease gives you. Okay.
100%.
The anxiety and fear and worry that comes with having a child with these conditions is just undeniable.
And it absolutely is. And it's like the only way I can describe that is like, I feel like being a parent of a kid with this condition, it's like you are staring at a puzzle on a wall and you have to figure out the puzzle in order to save your child. But the puzzle's constantly changing. And while it's constantly changing, someone's screaming in your ear. Then you still have to figure this out. And also no one knows how to help you. And so that is insanity making. And I think that's why there's so much like why it comes with just a lot, It
does. And I fully understand that and appreciate it. And I have challenges dealing with this population of patients. One, because I'm never dealing with the patient themselves. I'm always dealing with the party. that has its own inherent challenges. You don't live in your kid's body. You're doing your best to report the things you can observe from the outside. That's fine. We all have to accept that that's a difficulty.
Yeah.
And then I have to also deal with the psychology of the parent, whose psychology is grounded very, very heavily in fear.
Yeah.
You know, fear that my kid's going to be like this forever and there's no solution. Fear that my kid's going to get worse from one of these doses because that's a potential risk. And fear is a huge problem to deal with. It's very difficult for me to tell parents, try to ignore your fear and be objective about whatever happens, because none of you can do that. Because if you're a good parent, you just can't emotionally separate from the situation. You just can't. I mean, I have 9 kids, and I am probably the calmest temperament you'll ever meet. Like, emergencies happen. I've also had medical training, and I've also had about 1 million sleepless nights in my life. So my adrenals probably don't work anymore. But you know, like my 14-year-old son showed us this little video, like TikTok or something yesterday, and my wife was watching and other people were watching it, and it has this like jump scare startle thing, and everybody else like jumps and screams, and I didn't even budge. I'm like, oh yeah. So like my and my stress response isn't normal either. So for me but I understand that, like, when one of my kids is in trouble, everything changes, right? And so I get that. But
can you talk about your son who you say you use the Lyme antigen with, and why you decided to do that, and what symptoms he was having?
Yeah, well, that was 2016. He was in preschool, so he's now 9 years old, my son Bodhi. He spoke really late. He had kind of soft sign autistic stuff. Like, he was always in his own world. He had really delayed language. The way he would react to things was clearly different, kind of psychologically and emotionally, from my other allegedly neurotypical children, right? I'm not sure any of my children are normal, but anyway, let's call them neurotypical. And so we put him in a Montessori preschool, and his social interaction was just not quite normal. And I had already been in the DAN organization. I had dozens and dozens of autistic patients myself. So I knew that some of these features were leaning that way, but there's no way a developmental pediatrician would have pegged him as autistic. He wasn't quite, flagrant enough. But, the Montessori people came and they're like, we want to talk to you about him. We see some red flags. And here's what they said. And I said, yeah, I know about that. And I do a lot of that. And I told them at the time, I said, you shouldn't use the term red flag, because that scares the crap out of the parents. And then they don't hear anything else you say, just so you're aware. I was like, I know what you're saying. I said, why don't you call them soft signs? And they're like, oh, we love that. We're going to use that terminology. I'm like,
palatable. Yeah.
Like, you need to understand words matter to people. You can scare people and then you lose their attention. But so I was like, all right, we actually decided to keep him in preschool an extra year and not have him start kindergarten, because he wouldn't do any of the testing assessments. Like, he just wouldn't participate. He's a pleasant kid. He's happy doing this and that. And he would do some of the tasks, but he could not demonstrate knowledge because he didn't have that level of interaction, and he didn't care, right? So at the time, I had just started using the Lyme mixture on some other of my autistic patients and seen some of them responding. And you asked, why did I pick that one? Because in 2016, it's the only one I knew about. Okay. That's why. I just happened to get lucky. In 2016, I probably had maybe 10 or 12 different antigens that I was using, all total, 10 or 12 antigen mixtures. Now, Jeanette told me at last count we have 87. So just so you know, like, my knowledge base and the things that I've experimented with in the last several years is just exponential.
But even within one antigen, it could be all of these different strains.
Yeah, right. Yeah, so the Lyme mix is 74 different species of things. So it's not like just
Borrelia and Bartonella.
Babesia, Ehrlichia. It's 74 different individual species within 5 genera of bacteria. So I gave him that one, and the first dose, I started at like 8C, it didn't do anything, 7C, didn't do anything. And so we got to 6C, and within a week, he was obviously different. He was communicating better and more effectively. His interactions were more neurotypical. And in the following week, his preschool teachers said, he's like ready for kindergarten this week. I don't know what happened. but he did all the testing we wanted him to do, and he answered all the questions, and whatnot. And I was like, oh, he could go to kindergarten. We had already decided to keep him an extra year in preschool. So we just let him finish out that year, because I was like, well, he's delayed, he's got to catch up and have that experience. And so, but then he was able to start kindergarten in first grade, and he's about to go into third grade, and he's totally at, target reading levels and math and like everything. And every other kid in the school loves him. He's great. But
okay, so I've watched your videos about Lyme. And so I feel like an outsider would say, oh, so your kid had Lyme disease. And that I feel like you're going to say Lyme disease doesn't really exist, and that we all have Lyme in our system. And so he was having an immunological response to something that all of us might have in our system and not have an immunological response to.
Right. To break it down for people, Lyme is a city in Connecticut. Okay.
Yeah.
Capital YME is named for a city in Connecticut. It is not a disease. And the term Lyme disease and all of the history and thought behind it is wrong. So just forget anything and everything you thought you knew about Lyme disease.
Which isn't much, because it's so
you read the CDC website about Lyme disease. None of it's true, okay? Other than it has something to do with the Borrelia organism. But the second point is that it's really critical to understand the difference between infection and immune response condition. So, like you said, in my opinion, every one of us carries Borrelia species in our body as normal flora within our ecosystem. That's normal, that's fine. So if you had testing done, dark field microscopy, PCR tests, or whatever that says, oh, I have Borrelia, so what? So does everybody else. You also have E. coli, you carry various species of staph, strep. You carry 9 trillion organisms in your body, okay? This is just one of them. And that's called normal human existence. Yeah. The disease part only occurs if you develop an unnatural, unnecessary immunological reaction to the organism. Now, if you correlate that same concept to strep and PANDAS, you can get an infection with strep. It's called strep pharyngitis. You can get peritonsillar abscesses from strep. You can get mastoiditis from strep. So that's the infection part. Like if you get a fever, horrible throat, swollen, pussy tonsils, and then you take penicillin, and by day 3, you're totally asymptomatic and life goes on. That was a strep infection, okay?
And you agreed that antibiotics should be used for those acute infections. Yes,
because in that case, if you start antibiotics early enough, you prevent autoimmune reactions to strep from occurring.
Yeah.
That's the reason we get all uptight about treating kids with strep, is to prevent rheumatic fever is the main thing. Because once we developed penicillin in like the 1940s, you didn't see rheumatic fever anymore, like hardly ever. We learned if you started penicillin within the first week, you could prevent the development of that autoimmune syndrome. Some people carry strep asymptomatically. In fact, up to 10% of the population.
And that gets super confusing too. Like if you're a carrier, and I still don't totally understand. I feel like it's complicated. Like some people, what does that mean that you're a carrier?
That means you don't have illness. You don't have symptoms associated with it. Like Typhoid Mary, the classic. Like she carried Salmonella typhi and was spreading typhoid fever to everybody, but she herself was not sick. So that.
But wouldn't you say? Okay, so I guess you know how you said like everybody carries this within them, but you're not saying everybody carries strep within them. Only this 10% of people.
10%. So it's different. Borrelia. So here's my view of the world at this point. Borrelia does not cause true infection ever. Now you can digest that, because when people say, well, but the acute Lyme disease thing, that you get bitten by a tick, you develop a fever, joint pain, a rash at the bite site. Why isn't that an infection? Because I can make that go away with LDI, 100%. Even that acute illness within the first week or 2 or whatever after the tick bite, it all goes away with LDI. I've only had the opportunity to treat 2 people in the acute setting, because I lived in Alaska and there's no like ticks there, right? But I had a couple from a distance. One had acquired it in Oregon on vacation, came back to Alaska, so we could treat him right in the office. And we put him on antibiotics first, and he had like a herpes response. He got worse. and we gave him LDI, and his symptoms were gone by the next morning, like gone. So even in the acute illness phase of Lyme disease, it's immunological in origin. And in a kind of a purist sense, most infections are also immunological to some extent. Like, it's all about the balance between the immune system's reaction and the presence of the organism.
Yeah.
You know, so that's where the complexity comes in. That's why 10% of people can carry strep pyogenes and not have symptoms, because they tolerate it immunologically, right? But the other thing is, like, to explain the difference between infection and immune response condition, you have to just forget that you're dealing with a germ, okay? So let's say somebody who has Lyme disease diagnosis, for the sake of argument, has like weakness and fatigue and brain fog and muscle aches, joint pain, numbness and tingling in their extremities, typical crap you get with Lyme disease, right? You can get all the same symptoms from celiac disease. You can get all the same symptoms from gluten sensitivity. But we don't ever say that somebody has a gluten infection, do we? That would be stupid. So you have to see it like that. Like, what is the mechanism? Yes, the target antigen in this case happens to be a bacterium or a fungi or a virus or whatever, but you have to quit thinking in terms of microbiology and the infection model and start thinking in terms of mechanism. So when I talk to people, I want to know, do your symptoms fluctuate? Are they influenced by other immunological factors like stress or illness or antibiotics or vaccination, or where you are in your menstrual cycle if you're a woman? You know, what's the story, right? Has it been present for months that it's not an infection? That's a pretty simple one, right? We don't have chronic infections. I'm sorry, we just don't. With very rare exception. You know, chronic osteomyelitis if you're a diabetic or something that goes on, but they're still treatable with antibiotics. But anything that's an inflammatory condition that's just been going on for more than, 6 months, 3 months, is not an infection. It would have killed you by now.
And so to treat something like that with long-term antibiotics is like, I know, obviously, I know how you feel about that. Like, when people say, you know, my symptoms, that's the only way my symptoms go away is by being on either prophylactic antibiotics or.
And confirmation bias would lead people to think that that's proof that it's an infection. Well, go back to my gluten example. If you stop eating gluten, your symptoms go away. Does that prove that you had a gluten infection? No, absolutely not. It's the same thing. What you're doing is avoiding the exposure. So in those people who are lucky enough to see improvement with antibiotic therapy, it's because they happen to have suppressed the level of that target antigen bacterium to low enough in their body to be below threshold. But see, everybody's threshold is different, which is why for some people, it makes no difference at all, right?
Yeah.
Some people take antibiotics, it doesn't do anything because their immune threshold is a lot lower and more sensitive. So when people give me that information, what it tells me that's useful is what LDI dose they might end up needing. So somebody who does see improvement with antibiotic therapy is not as sensitive immunologically as a person who never got better with antibiotic therapy, right? Does that make sense? Because all you're doing is manipulating the exposure. Like, some people with food allergies can say, you know what, if I eat traces of gluten in my diet, I don't have to avoid soy sauce. I don't have to avoid all these things.
Yeah.
Gluten traces, I'm fine. But if I eat a piece of bread, I'll start to get problems. And in fact, I actually have to have a sandwich and a tortilla wrap and spaghetti for dinner, and then I'll get sick, right? So, like, everybody's got a threshold of sensitivity.
Yeah.
And those are the things that I ask about, right? Because that leads into me trying to figure out where to start them with a dilution and what they might react to.
And do you feel like the particular symptoms, like whether somebody experiences rage versus more of the OCD, or whether someone has tics, vocal tics, or does that ever speak to causation? Like, what you know what I'm saying, those particular symptoms, does that ever speak to maybe what could be causing it?
Yes, but all it does is narrow the field.
Yeah.
So it's very rare that a symptom has a 1-to-1 correlation 100%
Okay, that's
with
what I was curious.
an antigen. So people be like, well, I have all these symptoms that are common on the Lyme disease list. Like, yeah, they're also on the celiac disease list. They're also on the myalgic encephalitis list. They're also like all these lists, right? Like fatigue. Fatigue is the least helpful symptom ever since the dawn of time. Just whatever. You know, like you need to give me more than that.
Yeah.
Like if somebody has a fever, just like the old fever analogy, what else do you have, right? Okay, I have an infection, let's say, because I have a fever. Well, do you have a cough? Do you have a sore throat? Is your eye red and inflamed with pus coming out of it? You know, does it burn when you pee? Give me something else, please, because that's helpful. So brain inflammation.
Yeah.
You can get brain inflammation from a whole myriad of different antigenic stimuli. Specific antigens can all give you brain inflammation. How the individual person manifests their brain inflammation can be unique to them.
Yeah.
But it can all be like, if you give me 10 people who sound like they have somewhat different symptoms, right? They could all be reacting to the same exact antigen. Or you can give me 10 people who all have the exact same symptom list and all 10 of them react to a different antigen, okay?
Yeah.
So when I go through that list with people, the utility there, part of it is, well, let's use your symptom list and your history to generate a suspect list of antigens that are all candidates to try for LDI. But the bigger reason is I need to know what your problems are so that we can track those particular problems, right? So people will say, well, what symptoms should I be telling you about? I'm like, the symptoms that you have. That's what I need to know. Like, don't go by some it's like, well, what are the symptoms of this disease? And like, that depends on you. Because I've had patients respond to the Lyme LDI mixture who only had one symptom, insomnia. Like I've had a few people where their only symptom was this crazy insomnia. Even taking 4 drugs didn't put them to sleep at night. I had one woman where her only symptom was that her tongue was numb. That's it. Tongue numbness. No other complaints, even no matter how many times I asked.
Yeah.
And that responded to the LDI. My symptoms were plantar fasciitis and elbow tendonitis. So like I had those problems going on for a couple of years. And then in 2015 or something, I gave myself the Lyme LDI just for giggles, right? And they went away. and I knew it was connected because my symptoms would come back several weeks later and I'd give myself the dose again on schedule. They'd go away for longer. Wow. And then after a year or two of that, I was just consistently asymptomatic as long as I took my Lyme LDI dose every 7 or 8 weeks. And, you know, so you can prove that it's related, but I didn't have fatigue, brain fog, neurological symptoms,
right?
Tendonitis.
Common ones. And like, what other like huge surprises have you had with LDI where you're like, I give somebody an antigen, and you're shocked that it worked for something that it shouldn't have worked with, in a way?
That's like, happened 100 times.
Yeah.
like that's how you learn, right? It's like, well, let's just see if this works.
Yeah. Like, I mean, I know you talk about even like MS symptoms, symptoms that look like.
Right. Well, MS is a good example because MS has a clinical diagnostic criteria, right?
Yeah.
MRI lesions in the brain that are little white matter lesions that are scattered and they have weakness or spasticity or optic neuritis, whatever. You know, there's a pretty discrete rheumatological or neurological diagnosis of what we call MS. I can tell you that most people who have MS diagnosis will respond to the Lyme LDI mix. And I've seen their symptoms go away 100%. And I've even seen the brain MRI lesions go away, which that was a surprise. I did not think that would happen because we're led to believe that that's like scar tissue or something, right? That's damage. Well, guess what? It's not. You know, it's damage, but it can heal.
Really?
I developed a collagen LDI mixture for treating osteoarthritis. You know, we all believe that osteoarthritis is something you get from age-related wear and tear. Your joint cartilage wears down to nothing until it's bone on bone. It's irreversible. You take anti-inflammatories for pain. So, and I won't tell you how I came to this theory, but I got a mixture of collagen and I started giving that to people with osteoarthritis, and their inflammation and pain goes away, and they regrow cartilage in their joints.
So
and that isn't supposed to be possible.
And those people were sensitive to what then?
Their own collagen.
Oh, wow. Okay.
Right.
Okay.
So
yeah,
I don't know that there's a microorganism at cause there. That's the one example I can give you where, well, no, it's not. That's one of the examples I could give you where your own molecule, like literally your own tissue, is the antigen. Most autoimmune conditions that are considered autoimmune, the process is immunologically triggered by some microorganism that's not part of you. It's part of your ecosystem, but it's not human tissue, right?
Yeah.
Like MS, I actually bought a sample of myelin-based protein. For anybody who's familiar with MS, like the antibodies that you measure target myelin-based protein, which is something in your myelin, in your brain tissue. And I thought, well, that's the target. I'll just purchase. Turns out you can buy stuff like that. So I bought a recombinant DNA technology, human MBP protein, and I made an LDI out of it. It has never worked for anybody. Which was really disappointing to me. You want to talk about surprise? I was surprised about that in a negative way. It's like, God, I thought this would work. I developed an LDI of histamine for my mast cell activation people. That's never worked for any of those people either. So, I've had theories over the years that, what's that?
Sorry, what helps those people?
Treating them for what they're actually allergic to. So that's the thing, is if you focus on the symptoms and the target tissues that are being attacked, that's not helpful usually. In fact, hardly ever. The only example I can point to where the target tissue is the antigen is osteoarthritis with joint collagen. That's it. Everything else is a guessing game. Okay, everything else is a guessing game. It's been a learning experience for me for more than a decade now. Like, what antigens might cause this condition? What antigens might cause that condition? Like, I've had a lot of success with inflammatory bowel patients like Crohn's disease, ulcerative colitis. But I can tell you that those people with inflammatory bowel conditions are often, there's a half a dozen different antigens that are often involved enough that I have to try them all for a lot of these people. And with PANS and PANDAS, it's really similar. You have brain inflammation. And that's the part where we can agree, and we start there. So what are the things that can cause brain inflammation? Foods, strep, herpes viruses, Borrelia, Bartonella, Babesia, Candida for sure. Any gut organism ever, which is like 1,000 things. So it's really broad. It's not one thing. It's not four things. So like with my autism patients, I end up trying things.
Go ahead.
Sorry, you're cracking up. Just give it a second to settle. No, you froze. So I'll stop moving my hands. Maybe it'll be better. What were you going to say? That suggests.
And I want to hear what you were about to say about the autism patients. I think that's definitely like a light bulb thing about what you said about brain inflammation is that makes sense, because what is so frustrating about these conditions is that when you talk to PANS and PANDAS parents, what helped one kid is the same thing that hurt another kid, and there are practically no similarities in what has healed any of these kids. And so that makes sense that the brain inflammation is really just actually a symptom of whatever is actually going on.
That is well put. That is, in a nutshell, that is my point, that people should not see PANS as a diagnosis, okay? A diagnosis always has the same treatment in everybody who has that diagnosis. That's what it means. So if you've got this diagnostic label, okay, it's just a label. Your kids will end up with an alphabet soup of diagnostic labels. All these acronyms you never read and you never want to see again.
No.
ODD, PDD, NOS, PANDAS,
is a big one.
ADHD, OCD, like the alphabet soup goes on and on. That's not helpful in determining how to treat that kid. So when you're dealing with an immunological condition, there is almost always a potential diversity of causative antigens. And so laboratory data will not give you the answer about which one it is. It just will not. Like if you have somebody walk into the emergency room with a fever of 103, and then they run antibodies to mycoplasma and Epstein-Barr virus and, you know, the Coxsackie viruses and strep, they're going to be positive for all of them because everybody is. So we don't do that. If somebody comes in with a fever, you don't run a bunch of antibody tests to see what they've ever had a reaction to in their life. That would be asinine. It doesn't give you the answer. But in these chronic conditions, seems like every integrative doctor out there, that's what they want to do. And for some reason, they think it means something. It absolutely does not. It is 100% useless information that costs you a great deal of money and time wasted on treatments that don't work and emotional capital. Every failure is a huge expense of your emotional capital. Yeah. So like my advice to people is don't run any of these blood tests on your kid. They don't like it. They don't like being stuck by a needle. I mean, I have to stick myself with needles 12 times a day to stay alive, but I don't enjoy it ever. You know, kids really hate it. So just don't. If you see a doctor and it's like, well, we're going to run all these labs and see what they're reacting to, don't. It's a total waste of time. It's going to lead you, 95% of the time, it's going to lead you to the wrong treatment plan, not the right one. It's just not a good idea.
Okay, here's a question for you, because I know you mentioned homeopathy before. And when I feel like I've been on these, Facebook boards for a year and a half reading all kinds of stories. And first of all, I feel like 1% of people maybe know about low dose immunotherapy, maybe not even 1%. Am I frozen again? Am I frozen?
No, I can see you.
Okay.
You're not frozen. I'm trying not to move.
Yeah.
No.
So I feel like so many of the stories I read that have positive endings for these kids, and where there's a lot of successes with homeopathy. And so when I talk to people about LDI and I'm like learning more about homeopathy, I feel like they're cousins. Like, are they cousins? And like, how are they the same? How are they different?
Yeah, they are. I think cousins is a good analogy. I think they're similar in terms of the mechanism of action. So however it is that homeopathy works in a mechanistic sense, like you're giving somebody a vibrational signature. It's basically a energetic vibrational frequency signature. Like my favorite analogy is it's like a phone call, right? Like, here's my phone. I have no idea how it works. Zero. But I know it does, so I believe it, right? Results matter. In order to get my phone to ring, you have to dial the exact right 10-digit number, right? With a country code, so 11 digits. If you dial any one of those wrong, my phone doesn't ring. Maybe somebody else's does, right? But not mine. And that's how LDI is. Like, you have to find that exact right frequency. Homeopathy and LDI both operate based on that frequency dosage sort of concept. The big difference is the dogma and the nomenclature and the way that the treatments are implemented. So homeopathy is this complicated, very complicated system developed by Dr. Hahnemann in Germany, I don't know, 100 years ago now, give or take, or I don't know when, that has incredible dogma and tradition associated with it, none of which makes sense. Like my wife was going through homeopathy certification training at home for about 6 months or something, and reading all this stuff in the books and doing the tests, and she's like, this is a lot of nonsense, because she understands how LDI works now. My wife Jeanette is like this, I think, the second best LDI practitioner in the world, close second at this point. And she's like, this is all crazy. I mean, it's experiential, right? It's like, hey, we have all this experience that fills 18 textbooks, and this is all of these symptoms mean this and that based on trial and error, but it's not exact at all. The way that they use their dilutions, the way that they modify their therapy is a different set of rules of engagement than what I've determined. Could you use a homeopathic agent the same way as you do LDI? Maybe, if you tried, but homeopathy is usually symptom-based. So you're using substances that do, like treats like philosophy, like that can induce, like mercury, right? Mercury can make people crazy, psychotic, whatever. That's where the term mad as a hatter comes from, is mercury poisoning. So you use mercurium 30x or 100x to treat somebody who has neuropsychiatric symptoms, and you see some results. But that's not an antigen. Like, so within the field of homeopathy, they also have things they talk about called isodes and nosodes, which is much more akin to LDI. You're using the thing you think the person is reacting to, and it's a germ. In most of those cases, it's a microbe. And you're seeing these things respond. So when I get somebody who says, well, we use this strep nosode and we saw these symptoms respond, it increases the likelihood that they might respond to strep LDI. But there are different, I don't understand what all the differences are with homeopathics, because I'll see people who have a response to like a strep isode at 10x or something, which is only 1C conversion. It's 100 to 1 is 10x. So that's a 1C, which I never have to give anybody. And they'll have modest, something will happen in response, but then I'll give that kid like an 8C dilution of strep and their symptoms will go away completely for 5 weeks. Whereas on the homeopathic, you had to take it twice a day, So the thing is that the total cumulative dose over time matters. So if you take like a certain dose of a certain dilution every day, twice a day for a month, you need to total up how much you actually got. And then maybe that's your LDI dose for a month, like it's different the way that they use it. Like you could take a shot glass of water every 5 minutes all day long, or you could drink a glass of water every 2 hours, whatever, same level of hydration, right? The same kind of thing. So it's just, we use it a different way, but I happen to believe that the mechanism of interaction is probably the same. So when people tell me they had some responses with homeopathy, I think, okay, well then maybe this will, it's certainly not a guarantee. And it's more important to tell you that when people say we tried homeopathy and we got no results, that doesn't matter to me at all. Because I've got lots of people where homeopathy failed them, but usually it's symptomatic stuff that they're trying, symptom-based substances that has no correlation to what we're doing.
So. Okay. That's interesting. Okay, so besides LDI, like if you had a kid exhibiting neurological inflammation and along with LDI, I know that there's a million things you wouldn't do. Are there any other things you would say you would do, like that actually does help, that you think is a good idea? Like what are some things just to strengthen the immune system or help these kids?
That's a good phrase you just used, strengthen the immune system. That's a bad idea, right? So, because well, think about it. If you believe that it's your immune system that's attacking you and causing the symptoms, why would you want to strengthen it in that way?
Okay. Yeah.
Right. But if you help if you nourish the immune system in such a way that it functions more normally, that's a good idea. Yeah. It's an important distinction. Okay, because there are things out there that just boost immune reaction, immune function, like mushroom extracts just raise your natural killer cell populations. Well, that's not necessarily going to help you. It helps with cancer because that you need more of them for that or whatever. But if you are just enhancing T cell activity, for example, or something, that's not necessarily good. It's like selling weapons to your enemy that you're fighting against in a war, right? I would put in that category very, very clearly for people, stem cells. Systemic stem cell infusions, I think, are a horrendous risk that no one should take, to tell you the truth. In any immunological condition, if you put in systemic stem cells where they put it in your vein, right, you are just as likely to get catastrophically worse from that as you are to get any better at all.
Okay, because you're not talking about, or are you talking about IVIG?
No. Stem cells. Okay. Like And I haven't heard too many of these kids, like the PANDAS population, ever trying stem cell therapy.
No, I
But
don't.
a lot of adults who have chronic inflammatory disorders end up trying it, and many of them have been the sickest patients I've worked with to date.
Okay.
Have been people that got crushed by stem cell infusions. So IVIG is an immunological distraction technique. So it's like turning out all the lights when somebody invades your home. So maybe they have a harder time finding you. That's what you're doing. You're just clouding the battle.
Do you think that it works very well for some kids because it's almost like, well, let's borrow a lot of other people's immune system and see if it works to help my crappy immune system work? Like, is that how it works?
Well, that's not what it's doing.
Oh.
No, that's not what it's doing. That's what stem cells are supposed to do, to enhance your own immune. Let me know if I'm frozen. You're frozen.
Yeah, you are,
you
but
back?
not yet. Okay, now you're back. You're back.
Okay, I don't know if you heard what I just said, but
yeah, I did.
Okay, IVIG does not do anything to enhance your own immune system's function. Zero. It is just purely a smokescreen in your body, so that the immune reactions that are going on through your body that are caused by your immune system get fouled up. And that's why the responses are temporary. It wears off. As soon as those antibodies get processed out of your body, that effect is gone. It doesn't tend to have a lasting effect. It tends to have diminishing returns over time, where eventually it doesn't work anymore. Your body overcomes it because it's not regulating your own immune system response in any way. So it's crazy expensive. It almost never leads to true long-term success. It's a temporizing measure. It's a desperation measure. And it also carries unknown risks that scare me. Like, so if you had gotten IVIG infusions regularly in, say, 1985, you would have gotten AIDS, guaranteed. So, because we didn't know what AIDS was yet, but it was in the blood supply, and we were paying junkies for their blood, right? Which is never a good idea. Don't buy blood from anybody. And then everybody with hemophilia, everybody getting IVIG, everybody getting blood transfusions got AIDS, basically, in the 1980s. Terrible. So what viruses are out there in the population right now that we don't know about and we don't test for? Because we can only test and screen for things that we have already identified. COVID-19, not that it's bloodborne, because it's not, but it's a novel virus. Well, what else are we dealing with? What virus will come up in the human population next year that ends up infecting everybody who's getting IVIG? I think that's scary, right? So
I'll wrap it up with two questions. Like, when people talk about like COVID, I hear parents say, well, my kid is immunocompromised, and so they would have a really, really horrible effect. Or people say, actually, my kid is not immunocompromised. My kid has an overreactive immune system, and so I think my kid would overcome the actual virus, but then they might have all of these neurological symptoms. Can both of those exist, or are both of those wrong? Like, what should we be saying about COVID, and if you have a kid who has some of these, who has these issues?
So the first belief is totally wrong. People who think my kid is immune compromised or immunodeficient. Because I had a lot of patients email me that, and they're like, well, we're not letting them go anywhere because they're immune deficient. Like, they're not actually. Like, the statement that they have an overactive immune system is more accurate, right? That's the opposite of deficient. But the thing to understand is that what we're dealing with in these conditions has nothing to do with immunological defense. So there are two big branches to the immune system. There's immune defense, which protects you against true infections and cancer, which is an internal defense problem. And then there's immunological tolerance, which is a whole different branch of the immune system. It's actually a far larger branch of the immune system. It has a lot more resource devotion to it, because think about all the things in the world that you should not react to versus the small subset of things that you truly should defend against. It's hugely different. Your immune system has to actively learn all the things in the world and actively choose not to attack them. That's tolerance. So all of these people have a failure of tolerance, but it doesn't mean they have a failure of defense at all. It really doesn't matter. Okay? So it doesn't influence them.
Like they don't even communicate, like they're almost totally separate things.
Totally separate things, right? It's not related directly. Here's the problem. I make everything more complicated, just so you know. The illness that you get from COVID-19 is dependent upon immune tolerance, not immune defense. Because it's like, look at the fact that 75-80% of people who have gotten COVID-19 are virtually asymptomatic, or they have minor sniffles. So what's different about the people who have this catastrophic illness, or the kids who are getting this multi-system response syndrome a month later? That's an immune response problem. That's an immune intolerance problem. That's the crap I deal with on a daily basis with all these people around the world, right? That's what causes the actual illness. So again, it's not the infection concept with COVID-19, it's the immune response concept that actually is dictating illness and severity of illness, which is why when they look at the patients in the ICU, they're like, these people don't present like a viral respiratory syndrome, because that's not what they have anymore. They have an immune response syndrome, like ARDS is what they have. You got to treat it that way. So are the people susceptible to that, right? That's your question. Like, the real question is, does my kid have a greater chance of getting more sick with this than a kid without these diseases? And the short answer is we don't know. I think the odds are a wash. I think it's about the same as any other kid, because I've seen it go both directions. Some of the kids who have these chronic neurological inflammatory conditions, their parents will tell me, my kid never gets sick. Like, everyone else in the house will get colds and sore throats, and Bobby never gets sick. And I'm like, that's because his immune system is distracted with all this other stuff, and it doesn't bother reacting to coronavirus or anything else that comes along. And then other people will say, my kid gets sicker than everybody in the house every time something comes through. But it's random, you know? So it really, again, it's the individual and how they respond. You cannot categorize these people. You cannot say that because you have this condition, you are more or less susceptible to severe illness from COVID-19. You just can't do that. Biology is really complicated. You know, biology does not lend itself to the concrete factual basis of physics or chemistry or things like that in science, where every time you do a certain experiment, you get the same result. No, biology is adaptable and diversified, and it's all founded in chaos theory, to tell you the truth. You can give like 100 people the same starting event and just see what happens with their immune system, and you'll get dozens of different manifestations.
Yeah.
The way it goes. Which is why I will never be replaced by an app. Okay.
Absolutely. I mean, I think that is why so many of these families aren't getting the help they need, because there is simply not enough brain power and thought, because all these, it takes so much effort, and it being so personalized.
You run into each doctor's protocol, okay? A protocol is something you should run away from in every case. It's like all these I have over 200 doctors in our LDI network over the years. We've been, sending this manual I wrote at Antigens to start with. Almost all of them will ask me, well, what's your protocol for treating this? What's your protocol for treating that? And I'm like, don't think about it that way, because you're going to fail the vast majority of people who need your help. So you go to a doctor and they go, well, I'm doing Klinghart's protocol, which is 50,000 pills a day designed to kill parasites, detoxify metals or chemicals you may or may not have in your body. It's just, he doesn't necessarily, doctors like that who have an established history as an expert, they just give everybody this one size fits all protocol to follow, and it either works for you or it doesn't.
Yeah.
That's like going to Target to buy your clothes. You try them on, these are going to fit or it's not, versus going to an expert tailor who makes you a dress that fits you perfectly and makes you look great. Okay.
Yeah.
It's like, what are you going to do? Are you using a Flowbee, or are you going to go see a hairdresser? So it's like, that's what you get with most of these doctors, especially the so-called experts.
Yeah.
Because they no longer have the time to devote
Right.
to you and your particular kid's problem. They don't. It's
Right.
here's our protocol. It's $5,000 for the first month. Let's see if it works or not. Oh, it didn't work? Bummer. Sorry, it usually does. No, it doesn't. It just doesn't.
Yeah.
And that frustrates me, because a lot of the patients I work with want to name drop like all the experts they've worked with. And I'm like, yeah, that's cool. And now you're talking to me. So like, none of those people failed, but it doesn't mean I'm going to, but the thing about the optimistic thing here is that you have to look at everybody as an individual. You need to find a practitioner, does not have to be me. You need to find a practitioner who takes an interest in all the unique intricacies of your situation, who listens to all the details, who asks questions that none of these other doctors ever bothered to ask you, and who adapts what you're doing on an ongoing dynamic basis. Anybody who's like, try this for 3 months, that's not likely to work for you. I'm sorry, it's just not. I don't care what it is. With me, it's like, well, let's start with this and see where it takes us.
Yeah.
Here's my theory today, but I always have 4 or 5 antigens that I think might work. So it's not like we try strep and 5 doses of strep, nothing happens, then LDI failed you. No, it's like, that just means you're not reacting to strep. Here's the other 12 things we can play with, right?
Yeah.
So that's what you have to do. And it is admittedly frustrating and time consuming and confusing. And sometimes people get upset with me because they think I'm not listening to them. That's a unfortunately common thing, especially in this population. People have very staunch beliefs about what they think is going on with their child or their kid or the stuff they've read on the internet. And when I tell them that there's a possibility that what they think might not be true, they say I'm not listening to them. I'm like, I'm listening to you more than anyone ever listened to you before. I'm telling you that there are 5 other possibilities that you haven't considered. And if you shut your door to all of those other possibilities and the one you believe in is wrong, you're screwed. So don't do that. I'm like, just don't close your mind to these other possibilities, because I live in a world of a myriad of probabilities and possibilities. And I try really, really hard not to take my own theories very seriously. Because when you do that, you cause the same problem for your patients. When somebody says, hey, I think it's this and here's why and I want to try it, I'm like, okay, let's try it. Let's see.
Yeah.
Right? Whatever. What have you got to lose? A little time and a little money? If it didn't work, then we try one of my ideas. I don't care. I'm not the sick person. I'm not the parent with the sick kid here. I'm more than happy to do that. Where I run into trouble with people is when their analysis of what happened to their kid with a given dose differs from my analysis of it. And then they won't listen to me at all, and they just quit doing LDI. And I'm like, well, that's unfortunate, because we really don't know if it would have worked or not, and maybe it would have. And that's where developing a relationship with people is really key. I try to tell all these people who end up getting upset with me for one reason or another. There's not a lot of them, but it happens. I tell them, look, we have the same goal.
Yeah.
You want your kid to get better? I want your kid to get better. Okay. We're on the same team, right? This is not a battle. It's not a battle of egos. Who's right? Who's wrong? The thing is, we have to figure this out together. It requires both of us to a large extent. And most of the therapies that you do are passive on your end. The doctor doesn't partner with you. They say, here, take all this crap and see if it works. And then all you got to do is try to figure out how to feed that stuff into your kid, right?
Yeah.
And passive on your part. Well, this isn't. I need lots of information and analysis from you. And that's different, and it's challenging. And if I question your conclusions, it's not because I want to be right or prove you wrong. It's because I want to leave possibilities open and I want to help your kid. And somewhere in there that gets lost with some people. And I get it, because they're super frustrated, they're angry, they're fearful, they're burned out from trying all these things and being promised that their kid would get better from this or that therapy, and then they didn't. I totally get all of that. So when people get super bent out of shape and they quit working with us, I always end by saying, hey, we're here whenever you want to keep trying and whenever you want to pick up where you left off. Because it doesn't hurt my feelings. I understand that person, that psychology, like I get it. But if you try a bunch of other stuff for a year that doesn't work and you want to come back, totally cool. Come back, we'll pick up right where we left off.
Okay, well, we'll just end on this. Like, this is like a total other random thing. I know exactly how you feel about it, but I do think it's so important for people to hear why you would never, ever give a kid a tonsillectomy.
Oh, no, I wouldn't say that.
Oh.
I don't think I've ever said that. What, never give them a tonsillectomy? No. I've seen too many kids over the years where the parents told me, oh yeah, they used to just get sick over and over, and they would miss school, and they were lethargic, and then we got their tonsils out and they've been totally healthy ever since. That happens. Those stories are out there.
Yeah.
What you have to understand is that might not happen. Okay, so if the tonsils have become the focus of inflammation and immunological reactivity for that kid, when you take those tonsils out, their immunological discontent might focus elsewhere. So some of these people, what happens is, oh, my kid had chronic tonsillitis and he was just always sick and whatever. And then they took his tonsils out, and then he developed rage and OCD and insomnia and autistic features that he never had before, because now that inflammation has moved to the brain, or the inflammation moves to the gut, or it moves somewhere else. So some of these kids, their tonsils are irretrievable and they should come out. And then if they end up with all of that new immunological inflammation that just relocated somewhere in the body, then I can deal with that.
Oh, okay.
Okay, I can deal with that. But if they have diseased, irretrievable, just completely trashed tonsils, we can't fix it immunologically. So like sometimes it does have to happen. It's like getting root canal teeth pulled out. You should get your root canal teeth pulled out too, because it's a chronic, that does become a site of chronic infection and chronic inflammation that screws up everything else you're trying to do. So sometimes having tonsils removed is key to getting better, and sometimes it's the only thing you have to do to get better, but that's a small percentage. I would tell you, a lot of people who have their gallbladders removed, this is a common thing too. So I worked with gastrointestinal stuff over the years, and they have food allergies. Like the most common reason people have recurring gallbladder symptoms that end up getting diagnosed as acalculous cholecystitis or biliary dyskinesia, it's just that their gallbladder isn't contracting normally, or it shows signs of inflammation without stones present. That's where their food sensitivities are causing the reaction, is in their gallbladder. So it's just like the tonsil in the throat, right? So they go in there, have a gallbladder removed. A lot of those people will be like, I was great for 3 months. I had no problems at all. And then I developed chronic diarrhea and abdominal pain and vomiting and stuff I never had before. That's all GI. So that GI inflammation that was focused in their gallbladder got removed, but the problem didn't get solved because they have food allergies, and now their food sensitivities manifest in some other way. Yeah. And so that's what people have to understand, is that could happen. And when it does happen, it means that your problem is immunological by definition. So yeah, those are some story elements I always get out of people. Like, okay, so you had that removed. Why? Like, why was that taken out? People are like, oh, the kid had a tonsillectomy. I need to know exactly why. What was going on leading up to that? What happened? And then how did that change the calculus for their body? Did something shift right after that, or what? So those are the things that I look for in a patient's history to determine if their problem sounds immunological to begin with. Yeah. And also, what kind of triggers I'm thinking about, because food allergies can cause tics and OCD and rage and all these neuropsych things that you see in PANDAS.
Yeah.
Food sensitivity is really, really common, but food sensitivity does not tend to cause chronic tonsillitis. So it can. You can get just about anything in the body from food sensitivity, actually. So it's almost always one of the things on the table for these kids.
Yeah, we didn't really talk a lot about that, but right, I know you've said that do kids wear the food mix? And I know you have a food mix that covers a ton of different foods. Are they always the kids who have a lot of stomach aches and seem allergic to certain foods, or not always?
No, that's always really convenient. Like if you tell me, oh yeah, corn makes him throw up and carrots give him a rash around his mouth and he gets diarrhea from chicken, that's awesome, because then we have like specific foods that cause specific reactions, and we can use those as test exposures after every LDI dose, and we have a very high chance of success finding the right dose. But sometimes the food sensitivity reactions don't involve the gut at all. They don't involve itching in the mouth or hives or any other classic believed food sensitivity symptom, right? They just cause ADHD. In fact, for example, most kids with ADD are food sensitive based, is the cause of that for most of them, actually. And sometimes they have no other symptoms. So I just, over the years, if I get somebody whose like main thing is like an ADHD picture, and I ask all these other questions to see if other factors might play a prominent role, and none of them light up, I go, well, let's try the food mixture, you know, because maybe that's it. By default, it's always on the list, even if you have no other indicator of food sensitivity.
Yeah.
And that's true for any neuropsychiatric condition, to tell you the truth. You could potentially have no other symptoms.
Wow.
Yeah,
Wow.
super annoying.
We'll just leave it. That's a good truth bomb. So we'll just.
It's complicated. This is
Yeah.
really complicated, and that doesn't mean it's possible.
It's just been so helpful, because these are the things that, like you said, we all get these beliefs in our head based on things we think we understand. And so just to have that clarity on like what is true, what isn't, and to understand that this is super complicated.
It is. There's no clarity. It's nothing but uncertainty. It's trial and error. And you know what? As long as you accept that and you embrace the grind, I tell people, look, with LDI, you have to embrace the grind. This is not I'm going to give you this dose and it works for everybody and then magic happens. No, rarely, right? I love it when that happens. It makes me look super smart. It's total luck. It's like winning at roulette, okay?
Yeah.
So it's more like this process. But if you have someone who's experienced with this tool, the goal is to find the answers, to figure out what's going to work for you or your kid as expeditiously and safely as possible. And so that's a lot of the conversation I have with people now. I'm like, look, there are these 6 different antigens that might work or might not. We can try 3 or 4 of them at a time. Like what I do with a lot of these neuropsychiatric case kids these days is try several antigens at once. Because it speeds up the process tremendously. For years, I used one antigen at a time because I was learning, right? I had to learn which ones seem to work and at what dose range and what do the symptoms look like for this antigen versus another antigen. And what I can tell you after doing that for 5 years is that it's a mess and that they all look the same. And so I'm like, well, then now in the last year, my methodology has shifted to needing to figure it out for people in a more expeditious way. I've done this learning phase for years, and I'm like, okay, look, let's give your kid Lyme, yeast, and parasites all at the same time, which is a myriad of antigenic exposure, those mixtures, but they're probably only reacting to one of them. So who cares if I use what they don't need? It's not going to change the game, but it will speed up. Right, it speeds up the investigation process by 3-fold to just combine them, right? And if they react to this mixture and we care, we can always tease them apart later and figure out which one they react to for academic reasons, right? So that's what I do a lot now, is like, look, let's fast track this with the autism spectrum kids. I start them at much stronger dilutions than I used to, because now I've seen that they almost all need bizarrely strong dilutions. and I group their antigens 3 or 4 at a time. So instead of me having to spend 3 years trying to figure out what's wrong with this kid with autism, I can do it in 3 or 4 months.
Wow. And are the kids who have been diagnosed with autism, are they very similar to the kids diagnosed with neuropsychiatric things, in the sense that nothing really, it doesn't really matter, like their symptoms are the same, but the causation could be a million different things?
Right. What I've told people, like when I spoke at TACA a few years ago, which, you know, this parents group with autistic kids, there's thousands and thousands of them in multiple chapters all around the country. I use the analogy of corn allergy, you know, because I'm like, look, here's the complexity of the immune system. And I pointed at the parents at my little small group table. It was like 6 of them, right? I was like, let's say you're all allergic to corn, but you get asthma, you get eczema, you get diarrhea, you get arthritis, you get OCD, you get fatigue, right? And so your doctor is going to send you to a pulmonologist, a dermatologist, a gastroenterologist, a psychiatrist, a rheumatologist, because you all have different diseases and different diagnoses, right? No, you don't. You all have corn allergy. And so what you need is someone who understands that reality and looks for unifying concepts, common denominators, unifying information within your story. Because if you just focus on the symptoms a person has, you're going to get it wrong most of the time. And it was really great. My wife was there when I just did that analogy off the cuff, and everybody's like, oh, you know, because it is that chaotic. It is like a spider web. You have this event at the center of a spider web, and which strand of silk your kid follows is random, chaotic from there. So I have to try to ask all these questions and tease apart the history and figure out what centers might have caused this for your kid. And it's not homogeneous at all. So, and it should spark more questions, way more questions than answers myself. I have a lot of answers these days that come from experience that nobody else has, to tell you the truth, but I have just as many questions. And whenever I see somebody new, I don't take myself very seriously, obviously. But like, I look at everybody as their own case and new, and I have experience that makes me think, okay, I've seen this before, respond to these different things. It could be one of those, it could be something else. So many times in my career, I've tried everything that I knew and it didn't work for that person. So there's so much more that I do not know.
Yeah.
And that's okay. You know, if we're able to admit that, we have the possibility of learning. It's people who think they have all the answers now who are incapable of learning. And that's the antithesis of progress, and it's not in my nature. So.
Yeah. Amen. Thank you, Dr. Vincent. That was awesome. So appreciate it. And obviously people can get in contact with you and Jeanette via your website. I love how many videos you have. So they can go to your YouTube channel and just like watch you talk about molds or watch you talk about Lyme, all kinds of things.
I encourage everybody to do that. You know, some people are like, well, I have this person who I think you could help. I want them to talk to you. And we always say, tell them to watch all the YouTube videos first. Tell them to go on, you know, internet sites or whatever and learn about LDI before you talk to me. Because one, then you don't have to waste money spending half an hour asking me what's LDI, right? Which is a waste of money and time. And then people show up. People show up, number one, more optimistic because they have an idea this might work for them, right? 2, way more educated.
Yeah.
And 3, they're already more engaged in the process, and it just makes everything work better. So like, I don't like it. I really don't like it when people get a hold of us and I have a visit with somebody just cold. Yeah. They're like, so what do you do? Somebody told me to talk to you. What exactly do you do? And I was like, oh my God. I go, sometimes I'm like, why don't we just stop here? And you go these videos, because you're going to waste a lot of your time and money and still be confused. Like, cause you have to watch the videos sometimes repeatedly, you know,
definitely. Yeah.
With somebody next to you. Like, what do you think he's talking about? You know, it's like that complicated, and it's hours. Most of the people I talk to now that I work with will say, I watched all your YouTube videos, some of them 2 or 3 times. I'm like, oh my God, you are sick of my voice by now. It's a lot of time invested. But that's the whole point. And that's to my wife's credit. My wife's idea was to make videos for education and information. I was skeptical about it. I thought it wasn't going to help or whatever. She was totally right, as usual. And I was narrow-minded and pig-headed about it, which we're all guilty of that sometimes. But you know, she and I make a fantastic team, I think.
I appreciate Jeanette too. So thank you. I mean, I just so appreciate, because as you know, we've seen so much improvement with our own child, and I want that for other people. And I appreciate when, it just, there's so much of it that just makes sense. Even though it doesn't a lot of times make sense, it makes,
It makes sense if you try not to ground your mentality in the things that you already thought you knew.
Yeah.
Right? If you listen to the ideas of LDI and whatnot, and separate your pre-existing notions of the infection model, that's where people have trouble. Western mentality in medicine has been grounded in the model of infection for a century or more now. And to transition that to understanding the difference between infection and immune response condition is a huge leap, actually. So I tell people, think about it like having an allergy to a germ instead of an infection.
Yeah.
And if you can make that connection, oh, okay, well now I get it. And that's a good thing for people to focus on, you know, when they start concepting, because like the Lyme disease crowd, there are still so many people on the internet who like rant and rave that I'm insane because I say Lyme's not an infection. It absolutely is. And I could talk to those people till I'm blue in the face about all the evidence for how Lyme is clearly not an infection disease. Yeah. And they can't hear it. They literally cannot hear it because that is their belief system. So you gotta let go of that sometimes to hear something new and to have a really, really vital paradigm shift. And this represents that for a lot of people. This is a huge paradigm shift in how you understand your illness or your child's illness. And I wish I could tell everybody that it will work for your kid, like 100% guarantee. No way, I can't tell you that. These conditions are too complicated. And for all the reasons that I talked about before, the diversification of the immune response, the difficulty I have with some of the personalities and fear and whatnot that's ingrained in this community because of the illness, we have about a 50-50 rate of success with this condition. It's more difficult than most other things. And a lot of it is the mindset and belief system of the parents, to tell you the truth. So you just, what I would tell people is like, watch the videos, try to keep an open mind, conceptualize things in a different way. You have a better chance of success with this than if you stay grounded in what everybody else has told you to believe about it. And that's hard.
Yeah.
It's hard. It takes time. People a lot of times will say, and I know we're still rambling, I'm sorry. A lot of people will tell me, I heard about LDI 4 years ago and it didn't make sense to me then. So we tried IVIG and we tried ozone and I tried bee sting therapy and I tried putting coffee up my butt. I tried whatever. I tried all this stuff.
Yeah.
and then after all of that failed, LDI started to make a lot more sense. That's just the journey, okay? That's the journey for a lot of people. I totally get it because my journey as a doctor and, learning clinician myself went the same kind of route. I'm like, well, this makes sense. Oh, you know what? It doesn't work for people. Okay, well, let's try that. Oh, that doesn't work either. Or it works for some people and not others. And so I've already been there. I've already been through the journey. I don't fault people for hearing about LDI and thinking it sounds nuts. Totally fine. I thought it sounded nuts too when I first heard about LDA or EPD, but then I tried it. I had 2 kids with really bad eczema and some patients with horrific allergy problems, and LDA fixed them, completely fixed them. And nothing speaks louder than results. Yeah. So that's wherever you are in your journey, all the best.
Yeah.
Yeah. If it ends up here, great. If people end up getting results somewhere else, great. That's
Amen. Thanks, Dr. Vincent.
I'll shut up. We'll talk again later.
Thank you. Bye. So appreciate it. Have a great day.
You too.